Hello everyone, my name is Esther Herlock, and today we're going to talk about the association between sugar sweetened beverage consumption and BMI in the state of New York. To give you a little bit of background, first off, sugar sweetened beverages include soda, fruit drinks, sports drinks, energy drinks, and calorie sweetened water. Sugar sweetened beverages are the largest source of sugar in American diets, which lead to obesity and chronic illnesses such as diabetes and cardiovascular disease. The increases in consumption among adults and children are likely to have contributed to the increase in prevalence of obesity and diabetes in the state of New York, as stated by the New York State Department of Health. Now, the New York State Prevention Agenda for 2013 to 2017 established a goal to decrease consumption of sugar-sweetened beverages in those 18 and older. So the objective of our analysis here was to see if there's an association of sugar-sweetened beverage consumption and body mass index, and also take a look at the covariates that exist. The methods were to first look at 2016 behavioral risk factor surveillance system data, and the outcome of interest was BMI, calculated as kilogram over meter squared for height and weight measurements. Anyone who was underweight or severely obese was excluded in our analysis, and the exposure of interest was sugar sweetened beverage consumption, calculated as total consumption of both soda and sweetened fruit drinks on a weekly basis. That included 4 levels, which was 0 drinks per week, 0 to 1 drinks per week, 1 to 7 drinks per week, or greater than 7 drinks per week. And the covariates that we looked at were sex, age, Hispanic ethnicity, race, education, income, physical activity, history of cardiovascular disease, and ever having been diagnosed with diabetes. Furthermore, there was complex survey weights which were applied to all of the analyses, and descriptive statistics were generated for the combined sample and by weight status. So simple and multiple linear regressions were used to examine the association of sugar-sweetened beverage consumption with BMI, and those were done before and after adjusting for the covariates mentioned. The assumptions of linear regression were checked using a CPR plot, a residual plot, and a QQ plot, and no violations were found here. We used Stata Statistical Software version 15 in order to do this analysis. So the results of the 22,572 participants showed that 32% reported not drinking any sugar-sweetened beverages, 28% reported drinking 1 to 7 drinks per week, 19% reported more than 7 drinks per week. So sugar-sweetened beverage consumption across the weight categories were seen in normal weight at 32% with not drinking any, and 18% drinking more than 7 drinks per week. And the obese category had 30% reported not drinking any, and 21% reported drinking more than 7 drinks per week. If we look at our table here, there's some interesting findings. If we look at the sex category, males tended to be more overweight and obese at 59 and 52% in comparison to the 42% who were normal weight. If we look at race, those who were Black tended to have a higher obesity rate at 23% in comparison to the 13% who were normal weight. And if we look at education, college graduates tended to be in the normal weight category at 41%, more so than in the obese category at 27%. If we look at the history of cardiovascular disease, the higher we go up in weight, the higher the percentage. So normal weight had 5%, overweight 9%, and obese 11%. If we looked at the ever having been diagnosed with diabetes, the same is true with normal weight at 4%, overweight at 10%, and obese at 18%. So continuing with the results, looking at our crude model, there wasn't a significant association found between reported consumption of less than 1 to 7 drinks per week in BMI. However, there was an association with those who drank more than 7 drinks per week with an increase of 0.43 units BMI. When we looked at the adjusted model, the reported consumption of 0 to 1 drinks per week was associated with an increase of 0.49 units BMI, and the reported consumption of greater than 7 drinks per week was associated as well with an increase of 0.47 units BMI. If we look at the covariates, this table shows that females were had less of an association with high BMI. Those who answered no to being Hispanic had less of an association with high BMI, and college graduates had less of an association with high BMI. And lastly, those who said no to having physical activity in the last 30 days actually did have an association with higher BMI. In conclusion, this analysis provided supporting evidence for a relationship between sugar-sweetened beverages and body weight. So the higher the sugar-sweetened beverage consumption was, the higher the BMI was among residents of New York. So overall, the data suggests that avoiding all sugar-sweetened beverages may reduce the risk of being overweight. So public health campaigns going forward should promote alternatives such as water instead of drinking sugar-sweetened beverages. And future research should use dietary data to repeat similar analysis such as these with careful adjustment for other dietary confounders. And we should also examine the relationship of sugar-sweetened beverages with weight gain over time. So with all this information we gathered from this analysis, the intervention I wanted to propose selected a target population of New York Hispanic males with a BMI greater than 35 who only have high school diplomas. So randomized controlled trial would be beneficial in order to compare a control group and an intervention group at a 1-to-1 ratio, and a time frame of 6 months would be a good time in order to see changes. So both groups would initially attend a meeting and be given information and measurements taken and also take a survey. The information would involve data on the association of sugar-sweetened beverages with obesity and chronic illnesses. The measurements taken would be height and weight in order to calculate BMI and waist circumference. And the survey would involve answering questions about sugar-sweetened beverage consumption per week, water consumption per day, and health-related quality of life. So those questions for health-related quality of life would involve depression and anxiety, self-care, mobility, pain and discomfort, and function in social settings. So this approach would be at the individual level. It would provide a healthy diet to follow and encourage limiting sugar-sweetened beverage consumption and increase water consumption. And there would be weekly check-ins. And then we would also go at the interpersonal level, and this would involve talking with those in the individual's home environment, and they would receive the same information and be encouraged to help the individual in the intervention group succeed. The goal overall would be to reduce weight, so to reduce the BMI. And in order to reduce the BMI, we would hope to reduce the consumption of sugar-sweetened beverages, increase water intake, and this would then improve health-related quality of life. So the justification for this model is that obesity has been found that it is associated with worse health-related quality of life, and also sugar-sweetened beverage consumption has been found to have no benefit on the effect of health-related quality of life. In another study, only a small reduction was found of sugar-sweetened beverages among adults and adolescents, which highlights that there is a need to involve the home environment and a healthy diet, and also encourage the increased water consumption in order to increase the effectiveness towards reducing BMI. So the assessment for this intervention would be the measurements in this survey of health-related quality of life, as I mentioned, and this would be done at the beginning, middle, and at the end of the program. So future programs needed would be to address other modifiable risk factors and also identify groups by demographics and behaviors who tend to have a higher BMI. As seen in this conceptual model, we only address gender and race in this intervention, but there are other factors such as socioeconomic status and behaviors such as sedentary time or physical activity that would also need to be addressed in order to continue to identify ways to reduce BMI, especially in the state of New York. And these are the references used, and thank you very much.